Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. I'm here with Dr. Isaias Irgau. I'm the chairman of American Surgery Center, and Dr. Irgau is our president for our practice CRIAS, and also he's the clinical director at American Surgery Center. So this is our regular weekly events, and I just want to make sure these messages are taken care of, so then everyone can watch us. All right. So, Dr. Irgau, it's so good to be with you again. Now what's happening these days is I'm getting a lot more patient comments, and it's kind of interesting because in the beginning when we started, it was not the case, obviously, but now when I was at the surgery center last week, I believe, so a couple of the patients, they already knew who I was because they're watching these videos.
Yeah.
So, and then when we called them for the during our case conferences, they actually make references to the videos. So now we know that these videos are going to the right direction.
And they, of course, see you on the billboard on I-95 as well.
Now, as we are getting kind of adjusting our new fame and being famous now, we still want to help our patients, right? So today we want to discuss maintaining weight after bariatric surgery, and this is again just like any other topics that we discussed. This is one of those topics that we have discussed so many times, and we know that challenges are all there. So some of the things are going to be very similar to what we discussed in other sessions. Some are maybe unique, but if we were to kind of just look at this issue overall, what are the things that we need to be careful, how we can actually maintain, like I'm looking at one of our patients from our support group. He's referencing to 120 pounds weight loss. So that's great. So how am I going to maintain that? So this is a post-surgical issue, and the things to do and not to do. So then we are going to cover this from different angles.
Absolutely. It's an important topic. Clearly, it goes along with our assertion all the time that obesity is a chronic disease. You know, it's not something that you take care of once and then it goes away. It is a condition that is really very, very much part of the biology that drives it. And when we do the surgery, of course, we do make substantial changes in the way the digestive tract enables energy storage and energy consumption, but the basic biologic drive that gets people to become heavy in the first place cannot be addressed by the surgery itself, right? So yes, you lose weight after surgery, but you cannot ignore the importance of maintaining a healthy lifestyle, that it focus always on your care in what you eat, when you eat, and how much you eat, but also on how active you are physically. This has to be centered in one's life for a person to remain thin after they've had bariatric surgery. And for that purpose, when we explain bariatric surgery to patients, we talk about the fact that bariatric surgery is not a magic answer. I know you don't like that term, Kemal. You want people to think of it as something obviously wondrous, which it is, but clearly it's not a magic answer. We need the full attention, participation, and commitment of the patient for us to be successful in the long term. And of course, that's what we want. We're not looking, to help somebody become thin for their next high school reunion or for a wedding that's coming up or one event. We want people to become healthy for the rest of their life so that obesity does not become an impediment that has been for most of their life. But again, surgery alone cannot do that. The person also has to stay committed. From that point of view, I'm very happy to say, Kemal, that the vast majority of patients actually heed that advice. They follow it. And the reason is also because we spend a lot of time and resources and energy preparing people for bariatric surgery to begin with, right? We don't see people coming for consultation and we don't perform the surgery the week after that. Far from it. People are actually enrolled in a very extensive multidisciplinary program where they will be meeting with a nutritionist on a number of occasions. They will be seeing a psychologist, they will be seeing their surgeon, they will be seeing a bariatrician. All of this obviously wonderfully coordinated by our case conferences that happen on a daily basis. But what is the point? The point is we want to prepare the patients for maximum success. And because of that, the vast majority of our patients are successful in the long term. Having said that, it doesn't mean that patients will not gain a few pounds from their lowest after they've lost weight. A person could lose 120 pounds, but they could regain 15 pounds of that in the long term. From our point of view, that is still a success. In fact, as bariatric surgeons, Kemal, we define success in terms of weight loss surgery when we see that a person has lost and kept off 50% or more of their excess weight in the long term. So if a patient was about 100 pounds over their ideal body weight, if we can make sure they've lost 50 pounds or more and keep that off in the long term, we consider that success from our point of view, Kemal, right? There are, however, patients who struggle, and there are patients who struggle to great extent sometimes. Thankfully, these are a minority of patients, right? But one of the reasons we want patients to come and see us on a regular basis, even after a long time after bariatric surgery, is because we want to help them when this happens. The reason I find that patients actually struggle with weight regain in the long term, Kemal, is when something happens in their life that disrupts their focus. Typically, this could be, for instance, something happened, in their personal life, whether there was a divorce, losing a job, losing a loved one, that really makes them emotionally very, very stressed out. They lose focus, and then obviously they could gravitate towards utilizing food as a way to cope with that, right? And people may ask, but if they have a small stomach, if you've done surgery on them, how can they regain weight? How would they be able to eat and regain weight, even if they are really struggling emotionally? Well, the truth is, Kemal, is that even when you have a small stomach after a sleeve gastrectomy or after gastric bypass, if you eat continuously with high frequencies through the day, very high calorie content foods, obviously you are going to accumulate enough calories that the body will start storing energy, and then the weight could eventually come back. When people are in these situations, we want them to reach out to us, right? To make sure they come to us. And I understand very often patients shy away from doing that because they feel some kind of, they are almost ashamed to come back to us and say, look, I haven't succeeded with the tool that you've given me. But we're not here to judge, we're here to help. We want patients to reach out to us at the time in which they are the most vulnerable. We are their home. We are the ones who can really provide the resources, the support that will allow them to refocus again, right? So struggling can happen. It can happen 2 years after surgery. It can happen 7 years after surgery, particularly, as I said, if an event happens in their life that really gets their focus away. But we want them to really reach out to us, and we have the resources to do that. There's they can reach out and talk to their surgeon. We'll be able to get them together with their nutritionist. And then, of course, there are more resources nowadays. We can put them in programs, including weight loss medications that could be a wonderful adjunct for people who are struggling, in the long term.
Absolutely. So, the other issue is can we actually talk about the portion control? And I do want to make a reference to the Robart products. I have a couple of them with me, but this is one of the bars that we have. And this one is the beverage, and this is the pudding. So like if you were to kind of like look at them now why are they in my office? Because I use them. So for meal replacement. By
example, right?
Well, in many cases, trying.
Yeah.
So, but We use robot new direction products prior to surgery, especially in that for the 2 weeks pre-surgery. Do you recommend them to maybe do like a meal replacement with one of these products post-surgery?
Absolutely, absolutely. I think there is a place for that. It's not for everyone, of course, depending on their circumstances. But for instance, in the long term, utilizing one of these products as a way to go through the day, for instance, or to curb that hunger, or to curb that need to munch on something, right? It's a good way to do that. Why? Well, first of all, these are products that are full in their nutritional content. They will have all the important nutrients that one needs. Secondly, the caloric content is well restricted and controlled. And for the vast majority of patients, these are actually fairly filling after people eat them, particularly people who've had bariatric surgery, because obviously there is not much capacity within the stomach. They will feel full very quickly. Now, the good thing is they come in different flavors and also different preparations, as you showed them right now, whether it's a bar that you can eat, whether it's a shake that you can drink, or a pudding that you can eat, which is kind of semi-solid. They come in different varieties, and one can make them almost like a replacement of a meal during the day, particularly for people who struggle with needing to have something in the middle of the day. So that's one way of utilizing it. Another way, which I think is a good way of utilizing this meal replacement diet, is for people who, for instance, are struggling, for instance, to maintain that weight loss, or who want to really go beyond a certain level and they are hitting a plateau, in their weight loss journey. Right? I put them on a new direction diet for a couple of weeks, Kemal, for two reasons. One is, once you are on that new direction robot diet for a couple of weeks and you're not eating anything else but the robot diet, that takes the stimuli away, right? Stimulus avoidance, so to speak, right? Because when you are eating normal things, you are in the middle of the day or in the evening, and then you've got a choice. Shall I eat this? Shall I eat that? How about this, right? That by itself is very distracting in terms of really staying disciplined, right? Now, when you are on this diet, you don't have any choice. That is what you're going to have. There is no really stimuli that you have to be worried about. And that can break the cycle. That can break that habit that you are into if you do this for a couple of weeks. And then obviously you can refocus again after you've completed this. Another important use of the new direction diet, Kemal, is that it can give a person a jump start in terms of their weight loss, right? So if they feel stuck, for instance, they cannot be beyond a certain weight, well, they go onto that diet, they may lose 10 pounds, 12 pounds, and that jump start actually is a huge boost from a moral point of view per person to stay motivated and continue in their weight loss. So it's not uncommon for me to recommend the new direction robot diet even a long time after bariatric surgery for a variety of reasons. So you are absolutely right. It is very useful. As I said, it's not for everyone, but for the right person, actually, it can work very well.
So now I have a new water bottle, but of course, I'm not showing you, I'm not getting any sponsor, so it's still no sponsor type for show. So why am I showing this? Is one of the most other important thing is keep yourself hydrating, right? Hydration is important. So let's talk about that a little bit.
Yes, absolutely. That's actually a great point, Kemal. So why do we emphasize on hydration? Well, first of all, after people have had bariatric surgery, naturally they will be eating less food, right? If they eat less food, they will actually not get the portion of water that is incorporated in their food. If you look at most of the foods that we add, a great content of the food that we eat is actually water, right? So if you're not eating enough, a lot, which means that that proportion of water that you are getting from the food, you're not getting any longer. You have to replace that because our body needs constantly a certain amount of water, right? So that is important. Another reason why focusing on hydration is important, Kemal, is because when you've had bariatric surgery, you cannot afford to become thirsty and then try to catch up by drinking a lot of water. And the reason is simply you don't have enough stomach capacity to drink a lot of water at once, right? I have a bottle of water right here, Kemal, and if I was very thirsty, I could drink maybe almost all of it at once, even because my stomach capacity is normal. But if I had bariatric surgery, I would not be able to do that, right? So we don't want people to wait until they are very thirsty, because then they may not be able to catch up, soon enough. And the best strategy to do that is to understand that water is a very critical part of what they have to do through their day. And just like you have showed, Kemal, they should have some water with them at all times. And what I tell patients is to take a sip continuously, right? So if they are not talking, if they are not eating, if they are not sleeping, they are sipping on water, because small amounts taken continuously actually can go a long way to provide them the amount of water they need on a daily basis. One of the examples I tell people is that if you want to fill a bucket with water, you can put it under the tap, turn the tap completely, and then it will fill up. That's one way of doing it. Another way of doing it is to put that bucket there and then let the tap drip, right? If you leave it for long enough time, enough water will actually come in through the dripping to fill up that bucket. So that is another strategy for people to utilize. But you're absolutely right. Hydration is very, very important.
So now with that, unnecessary calories, and one of the easiest one, and unfortunately maybe part of our social socialization, or the way that we socialize, alcohol is a big factor. And going through a party, especially now the holiday season is coming in, I'm sure we'll have another session regarding that. But any other, like there was some celebration the other day, alcohol, the open buffet, open bar was one of the main things. So avoiding alcohol is going to be important. But are there any tips? I know we have a specific session for that, but in case they are not watching that, for the alcohol, like one better than the other, or how can we completely avoid it?
Yeah, absolutely. And you're absolutely right. This is such an important topic. As you said, we usually will have a full session talking about it, but you're absolutely right. So whatever we drink with alcohol is what we call empty calories, right? It's just going to be there to fill up with more energy that the body will be storing without us getting any nutritional value out of it. But more importantly, obviously, alcohol, particularly alcohol excess after bariatric surgery, can be very dangerous, because alcohol excess after bariatric surgery is not alcohol excess in the normal situation. The normal situation, for instance, a person may be able to drink 2-3 glasses and not think much about it. But with bariatric surgery, that is actually far too much, far too much, not only in making the person drunk very quickly, but also because it can lead to liver damage with much less alcohol than a person might think, right? So that's one idea. And then the other thing is, as we know, is alcohol is something that increases our appetite, right? The more alcohol one drinks, the more they want to eat. So it's really very much deleterious from that point of view. And then, of course, the other biggest issue is if a person has any inkling to become really dependent on alcohol, that is something that they don't want to touch at all. So if they had any issues regarding alcohol intake before bariatric surgery, in fact, my recommendation for people is to absolutely abstain completely from alcohol. So there are definitely problems associated with this. Of course, the other practical problem, of course, is dehydration as well, if they are drinking alcohol instead of drinking water. I do want to go back to the water with one other point that is worth mentioning, Kemal, and that is very often with the way we have really structured our society, where there is really no clear distinction between eating because you're hungry or eating because it is pleasurable, and because the fact that getting food is not such a difficult task anymore, we have actually sometimes have a hard time distinguishing between thirst and hunger, right? Very often people, they think they're hungry, but really they are thirsty. So very often when you feel hungry, if the first thing to do is reach out to and drink some water, maybe that hunger actually will go away, because what your body really is telling you is that you need to drink water as opposed to getting food. So making that distinction clear is very important, and that's why drinking enough water, is another good thing also, because it will prevent you from eating unnecessary calories.
And leading by example, so I'm gonna have let me share something. Unfortunately, the screen doesn't capture. I tried, but what you see here is the physical activity. So our other really important issue is, which is going to help us with maintaining weight loss, is the regular exercise. And if this picture was a little bit better, it would be better. But the average steps is about 97, almost 10,000. Let's call it. Let's round it up to 10,000. So. And it's really just two walk sessions, 2 sessions of walk, one in the morning, one in the afternoon. Total is probably a little over an hour together. So that gets you easily 9,000 steps.
And how do you track your steps, Kemal? Do you have a smartwatch or a Fitbit? Show your cell phone. So almost everybody has a cell phone nowadays, which means if they keep their phone with them, they are able to track their steps, and they should. That's really a very good habit as well.
And I think tracking is really important for other things as well. So, like, we know that the regular exercise, have so many other benefits other than the weight loss or maintaining with the circular system. Especially patients with diabetes or heart disease, this is an extremely important one. And one thing that you always say, doesn't have to be like a really heavy exercise, is to walk. It just, you need to get up and walk, and just maybe 700-800 steps and come back. That's fine. That's still okay if you are doing it with enough repeats. So, but tracking is kind of like a good way, at least like people like me. I'm kind of competitive with the numbers, so if I see it, like if there was a day the other day that I was going to be less than 10,000, I forced myself to go out and walk. So there are ways to actually do it and keep track of your activities. Now, last time, 2 weeks ago, I shared this, and I'm going to share it again. Mm-hmm. So I use this on one hand, I use it for, the struggles that we also go through. Even without the morbid obesity, we still have issues to keep and maintain our weight, and in some cases try to lose some. And one of the reasons that you see these robot products is because it's part of that. But I think 2 weeks ago I shared this, and I'm going to show you guys again. These are the days in September that I was fasting, intermittent fasting. And there are 16 logs here. So out of 30 days, there's still tomorrow, right? Take the eight of them for the weekends. There are 22. I may be missing a couple of them, but let's say I didn't miss any. 16 out of 22 days, mm-hmm. I'm fasting. Yep. And still not easy. Okay. Mm-hmm. So I think this would help people to understand. This is also part of the tracking, like track what you eat, mm-hmm. how you eat, and then you'll be able to actually see, like this. Actually, there's one that gives us our total number of hours. So average 16 hours. No food or no food actually. So that's how it is happening. So knowing this is for all of us, then hopefully people would have a better kind of like understanding of what it takes to get to this level. Yeah, absolutely. And it's still not happening. Like I'm sure Dr. Ergau tonight we are going to talk about some of my issues. Like slow process, like why am I like I'm doing this, I'm doing that, but the process is still slow. That means don't give up, because it's just it's coming, but it's coming slowly. But patients with 120 pounds, 130 pounds, 80 pounds, 90 pounds, when they lose that much, that already is a great motivation. So now it's all about having good habits, keeping and maintaining those habits. So the walk shouldn't be like part of like, well, damn it, I have to walk again. It should be fun. So make it fun. Like, what do you like? If you need to listen to music, you can. If you need to read a book, you can have your audio and then listen to a book. You can like on these days, YouTube. If you pay the premium monthly, it doesn't have any commercials. You can listen to anything. It doesn't have to be music. So you just need to find things that's going to keep you occupied while you're walking. So then things are going to be easy. So that's not just post-surgical patients, but people like us. We have to go through the same thing. Dr. Ergau, what about the support system? What would you say, other than let's take our dietitians out of it for a second? What's the best way to have a support system? Who would be those people in that support system?
So the support system, in my view, is to stay connected with our practice, right? Stay connected. There are different ways of doing that. Of course, there are the regular scheduled visits. The visits, after bariatric surgery are fairly frequent in the first couple of years. After that, we have a maintenance yearly visit, right? That patients that follow up with us, but it doesn't have to be that way also. If patient needs to come and see us sooner, they can. On top of that, as you know, we have the support group, which I think is a very important way really for people to stay connected and also to get support in terms of really having a shared experience with others, right? And we do our support group once a month. It's the first Tuesday of every month. Nowadays, it's done virtually, and people, as you know, can register through our website or our Facebook page and then participate in that. And there will be a variety of topics that are discussed. And although there will usually be a moderator, there really it's a discussion between the people who are coming seeking support. And then there will be people who had surgery recently. There will be people who had surgery many years ago. But exchanging tips on how to take care of different issues is a valuable way of gaining support, obviously. And then, of course, on top of that, as I said, there are these sessions that we do. These sessions are not just for people who are thinking about bariatric surgery. In fact, the topic today really is how you maintain, your weight, the weight you've lost off, in the long term. So clearly, this is really geared to people who had surgery already as well. So these are different ways for people really to get support. And even if these are things that people know, just listening to them, again, and having a different way of issues being explained by itself is actually a way to reinforce and to get you motivated to do things that you've thought that you plan to do for a while, but you haven't actually done it. So this kind of support is important. So the last thing we want, Kemal, is for a patient to have gastric sleeve, be seen 2 weeks after surgery, and then disappear from our radar. That's really not a good way to do it, particularly because there are many issues that require follow-up in the long term as well. And not least of them is the fact that we want to make sure that nutritionally the patient is actually getting all the nutrients they need, all the vitamins they need. And one of the things we do on a regular basis in the long term is to check vitamin levels by doing blood tests. These are important. These are obviously critical and very, very important for procedures like gastric bypass or the switch, but they are still important even for people who've had the sleeve or the gastric band as well. So all the more important reasons for people to really stay connected with us in the long term.
So as we always say, this is a challenge, but once you master certain things and make them permanent, make it permanent habits, that's how things are going to be easier. So our mind has a lot to do with it. Sometimes like, we just delay things, and knowing how serious this change is going to be, and it already is touching so many people's lives, and seeing extremely good results, how can we keep this long term is going to be the motivation. And there are so many different ways, different tools out there to educate ourselves. And as you mentioned, this is one of this show is one of those vehicles out there, and we want to be able to help more people, and hopefully we can reach out to more people out there. Again, Dr. Irgau, thank you. I think we did cover everything. Did you like my new bottle? New water bottle. I'm trying to get a sponsor.
We'll get one day. Nice, very nice.
I still have to pay for it. So in the next year, our goal is to get a couple of sponsors so we don't have to pay for these.
Right.
So, well, thank you, everyone, for being with us and watching us. Dr. Irgau, as usual, thank you.
Thank you,
and
Kemal.
see you guys next week. Bye-bye.
Absolutely. Thank you. Bye-bye.